So for those who didn't see it, I guess it was 2 months ago. I think it was in early January. We were talking about this new drug coming out, and it is a drug that's actually used to treat diabetes. And the one I was specifically talking about was called tirzepatide, and the trade name is Mounjaro. And this one is actually not quite on the market yet. It's getting FDA approval like anytime. But it's related to 2 other drugs that are out, Ozempic and let's see, the other one is Wegovy. Sorry, I forgot the name of it. And those have been out for several years now. The drugs are similar, but Wegovy and Ozempic are what's considered first generation for this type of drug. And the difference being is that those drugs act on one receptor in the stomach which tells you you're full. So there's a receptor in your stomach that gets activated to tell you, okay, I'm full, don't eat anymore. And this drug mimics that, the molecules that target that. And so when you take the drug, you feel full, you don't want to eat. Now the way that tirzepatide or Mounjaro, which is the one that we were talking about in January, is different, is it has a second mechanism of action which actually slows down how fast the stomach empties, because when your stomach gets empty, that's when you feel hungry.
Yeah.
And so and the results are way better with tirzepatide. And I have to say, to the point that since that episode we did in January, we've been in touch with Eli Lilly to try and kind of be on the forefront of maybe offering that medication in our clinic, because people were seeing weight losses of 30%. Meaning if you started out, at 240 pounds, people were going down to like 160 after taking the drug for about a year.
Yeah.
And it has a pretty good safety profile. But in the past week, on I think it was Fox and Friends or one of the Fox News segments, Mark Siegel, who's a well-known, is he as well-known as me, Mark Siegel? I'm just kidding. He's like way more famous than I. You know Mark Siegel? Really? Travis Mark Siegel?
Maybe if I saw a picture of him.
I don't know the name.
Oh, okay.
I'm an image person.
Okay, well maybe I know him just because he's a doctor and he's on TV, and so
Probably.
it's like people in your
Yeah.
in your industry. I'm like a little fish in a little pond, and he's a big fish in a big pond. But we are doing kind of the same thing to a certain degree. Anyway, so Mark Siegel, he's a big guy. He was on Fox News, and he was talking about a new study that came out from China. And the study looked at the first generation diabetes drugs for weight loss. So that's Wegovy and Ozempic. And it should be stated that this study was a mice study. So what that means is the research was actually giving the drug to something, but it wasn't a human, it was a mouse. And the reason that's important, not to spoil, would say later, is that a lot of times the data you collect from mice studies doesn't correlate to humans. I mean, we're both mammals, right? Mice and human, but we're not exactly the same.
No.
And so drugs do have different effects on for example, Coumadin is a rat poison. And humans take Coumadin all the time. But that's more of a dosage thing, not necessarily physiology. But
yeah.
I digress. This is a mouse study. So
This is my cough.
Yeah, this is a mouse study, so that does need to be taken into account. But the study showed that Wegovy could cause intestinal obstruction and intestinal dilation, which all kind of fits together. And then Ozempic can cause eating disorders.
Okay.
Now, so he was on there and he was saying, these drugs are so popular. Elon Musk took one of them. I think Elon Musk took Ozempic. They were talking about him.
My sister is taking one.
Oh, really? Mm-hmm. Wow. So, okay, can I ask you where she's getting it?
She got it prescribed.
Obviously, I didn't.
Yeah, by her doctor.
So her primary care doctor did it. Yeah.
Well, she was on track to be diabetic. It's like she's on that
So
pre-diabetic.
she was taking it for diabetes.
Well, she hasn't been diagnosed as the diabetes, but like when you pretty much are, whenever I was in school, if you were pre-diabetic, you had diabetes pretty much. You just had it in a situation where it could be reversible.
Yeah.
Like when you get diagnosed with diabetes, like you have to start taking medicine and like all of this stuff, and you never can get off of it.
Yeah, and a lot of it is related to weight. Was your sister heavy? Not to like pry into it.
Yeah, she's my height, but she's overweight.
Yeah.
Yeah.
A lot of times, as people gain weight, it puts you into like a pre-diabetes or even a diabetes state. So the drug can definitely help that.
Yeah, I'm interested to see. I haven't seen her in a little bit, so I'm interested to see. She lives in Austin.
Awesome. Okay,
so I'm interested to see if it
So Mark Siegel was all like sounding the alarms about, Ozempic and Wegovy because of this study. And I mean, not like crazy sounding the alarms. He's like, oh, we need to be careful, but I mean, that's how a lot of those doctors are. Everything is like, oh, this is a big deal. I don't know. So I was thinking my thoughts on it, and I'm kind of more a gray area about this. And some of the things they did talk about was the fact how now Weight Watchers is doing these drugs via telemedicine. I do kind of have a problem with that. I think that if you're going to take these drugs, it does require actually visiting a physician in person. And I mean, these are not unsafe drugs, but they can have some potential side effects. Mm-hmm. One, you want to make sure that you're not losing too much weight, or that you're, on this drug for a long time and it's, causing potential issues. So you need someone to kind of follow you. And I don't know if telemedicine is the best way to do that. I'm not sure how I guess Weight Watchers is hiring doctors to do that. And so
I don't know. My parents did Weight Watchers.
Like back the original Weight Watchers.
Yeah, where they weekly meetings and weigh in and all that kind of stuff.
It works. I mean,
yeah, it totally worked for my dad.
So they were talking about the potential risk, which I'm not like really sold on that risk, because one, it's a mouse study. Two, these mice are on the drugs for like 2 years. I mean, I don't think someone should be on these drugs for that long. Mm-hmm. The study that I quoted when I was talking about tirzepatide was more along the lines of 12 to 14 months.
Yeah.
Being on it for a year to lose that weight and then coming off of it and not staying on it long term. I mean, there is the potential for rebound, but the way I would this is how we would do it in my office, and I'm hoping we get the chance, is, you go on the drug, and then when you get to your weight loss, then you do life modifications to keep that weight steady. It's not like you take you get the weight loss and you come off it and you start doing all the things that cause you to gain weight in the first place.
Yeah,
you
it's
would
definitely
educate
a lifestyle change.
I'd send them to your CrossFit gym.
Shoot, dang, yeah, you should. Yeah, that's what I was reading about whenever I was looking at stuff to talk about, because I figured you would talk about this because it was new. But yeah, whenever I saw it, some doctors were saying to their patients that if they went on it, that they would never come off of it. That they warned them that
I think that's crazy.
This is a forever drug that you have to take for the rest of your life.
Well, okay,
et cetera, et cetera.
I would say if you're taking it for diabetes, maybe.
Yeah.
But there's definitely a distinction between taking this drug for diabetes and taking it for weight loss.
They were saying for everything. Like, if you start this drug for
that, then it's
because it's like, if you get off of it, you're just going to be back in the same
I mean, I don't know if that's true, because
I mean, I could see how that would happen, because there's people that go get surgery, and the bariatric surgery, and they lose 100 pounds, and then after all that, they still gain 100 pounds back within 2 years.
I personally haven't seen that happen quite as much as.
Yeah, but I mean, that's what they said in that article I was reading.
I don't know. Maybe. I'm gonna give that one a maybe.
I mean, that's what. I mean, it's not. I mean, I don't know. That's just what I was reading in that article. The doctors were saying that it's
You'll have
forever.
to send that to me. I'd like to look at it. Just email it to me. I do want to check it out, because I'm interested in these drugs. The ones that they're talking about, Ozempic and Wegovy, had a 15% weight loss. This new one has a 30% weight loss. It's twice as good. Which means you could have people on it for less time, I think.
Yeah, I would definitely think that if you go on it, you should.
You try to get off of it.
I think you should. They should be linked up with or recommended a nutritionist.
Yes, exactly.
Something.
That's how what we wanted to do, is have this kind of comprehensive
and a physical
plan.
Trainer.
Mm-hmm.
Yeah.
So I'll keep you posted. So obviously, with this article coming out, my personal thoughts. I mean. As long as you're talking to a doctor about taking this drug and not just getting in some back alley or over the internet, you probably don't have anything to worry about. Your doctor's going to watch out for you. So, this study is interesting. It is in mice, which doesn't necessarily correlate to humans. These mice are on these things for long periods of time, which I don't think you should be on the drug for that long. So I think used properly, these drugs probably are still very safe, but we will keep an eye out for further research and make sure that this is something that is safe for anyone that wants to take it. So.
Yes.